Hello, licensed mental health clinician with diagnostic privilege and certified end-of-life doula, Ami Clark here. It has been a very long time, it seems like, since I've made a video like this. I've been concentrating a lot on the politics going on in this country, on my personal YouTube, so I haven't really been doing a lot about mental health counseling, but I was thinking about the politics of this country right now and how it has changed and not for the better, and how many communities or several communities are actually suffering under this political environment. So, as a therapist, they often taught us, when I was studying as to be a therapist, we're often taught to be objective, okay? And that's important in therapy. However, we're also told a lot of the time that we should not talk politics, especially if the subject comes up, to find a way to change it. And I did that for a while. But a colleague of mine, who I'm not going to name, straightened me out about that and actually was very honest with me and telling me why I need to give space to politics, give space to whatever a person needs to say. And this colleague was right. They were definitely right. And so I started doing that. And I'm going to be honest and say it has not been an easy ride, because most of the communities that I work with who are clients of mine are immigrants, trans and gender diverse people, and I am certified to facilitate the refugee assessment. I haven't done that yet. I'm assuming they're probably not going to come out and try, because we've got we've got ICE out kidnapping just about anyone. At least that's what it looks like a lot of the time. And after what I've seen, I believe that is so. As a therapist, it's difficult to listen to my clients, especially because, therapy is triggering and countertransference can happen in a heartbeat. And my clients, who are the people being persecuted, specifically the immigrants and the trans and diverse community, they're scared. So working with them and helping them through their fear has been a big part of my job since this administration. I want to put this out there for clients as well as therapists. A lot of us are going to be sitting with clients from communities who are being persecuted by this country. And we're going to be hearing a lot of what they're experiencing, the fears and everything, no matter where you are and what state. Okay, specifically, especially red states, where a lot of this is going on even more so. And even Minnesota, places like that, and New York City, which we're fighting because we have a mayor and we have a governor who don't agree with what is happening. It's going to affect us as therapists, as clinicians, because there was also the people that voted for this administration. And I remember having a conversation on a mental health group that I'm on, with a bunch of professionals, licensed clinicians, who are having difficulty wanting to counsel these people who voted for this administration, because many of them have had to sit and be objective towards the horrific shit that they have been saying. And please excuse my language, that's unprofessional. But a lot of the stuff that they say, and they've been asking for advice on how to work with clients like this. Now, I'm going to be honest. On my end, I spoke to my boss, my boss who owns the practice that I work at. And I was honest and stated it probably would not be a good idea if I worked with people with MAGA, with therapy. Not that many of them go to it anyway. But I don't think I would be the right person for them. And I learned that the hard way, okay? Because I was always about being objective until this administration. And now it's like as much as you don't want to put yourself, because the ACA Code of Ethics teaches you not to push your beliefs on anyone, on any client. It's very hard also for a therapist to sit down and have to listen to a lot of the racist stuff that has come out of some people's mouths in therapy sessions. And some of us just, we're not right for that person, because that person needs to talk to someone even more objective than we are. It doesn't mean we suck at therapists. We're actually quite good at it. It's that a big part of being a therapist is knowing when you are not a good therapist for a client. So you refer them out, which is what I usually do. And they end up with good colleagues of mine, or they end up with good practices, or with other therapists in the practice I work with who are absolutely fine with it. Okay, I would much rather they get the care they need than end up with someone who is who not even resentful, but will not be a good fit. And they wouldn't like my office anyway. It's covered in LGBTQIA colors, so they probably not appreciate that, because my main niche is narrative trauma therapy, but also gender affirming care for adults, and because I don't work with children. And basically working with people who are going through traumas, especially the traumas in this country right now. So this is my advice for therapists. If you feel the need to not want to work, or if you find, that's the better word, if you find that you cannot work with someone who voted for this administration, you cannot work with someone who is MAGA, do the right thing. First, talk to your supervisor if you don't own a practice. And tell them, be honest. I was very open with mine. I love my boss. My boss is amazing and very understanding and very empathetic. But if you're going to do that, remember that it is your responsibility to refer them out to someone who is willing to work with them. The least we could do is help them get their services. That is our job. We don't have to counsel them, but we can refer them to someone who will. That's our job. Okay. So I know that it has been difficult for a lot of therapists, especially in this with the subject, but that would be my advice, my professional advice. The other part of that is clients. As hard as this is, it's hard for me. Put down the social media. I have to put it down at least when I'm sitting with my husband, because then I don't look at what's going on. I'm present. And also I am not constantly hyper vigilant, because when I'm constantly looking at social media, doom scrolling, I am my hypervigilance goes through the roof. And I'm waiting for like last night, I made the stupid mistake of doom scrolling. And I literally thought we were going to have a home invasion because I freaked myself out so badly. That's not a good idea. That's not healthy. So I guess what I'm saying is be healthy mentally by pacing yourselves with doom scrolling, or at least putting the phone down. This is a rough world we're in right now. We're in a timeline that is very triggering, to say the least. So be careful out there. Therapists, my fellow colleagues, practice self-care and be safe. Be well, everyone.